we're going to come down to the third rib and just come up just a little bit into that second intercostal space. So right above the third rib. Now we're going to draw a line. We're going to keep palpating that rib all the way over to the midclavicular line. We want to make sure that we are not too medial because we could hit that heart like I was talking about before. So we generally want to be lateral to the nipple line here and keep that pretty far out. Now obviously that's going to change depending on anatomy, but we do want to make sure that we're not too close there. So once we've identified the site, we're going to take our needle and then we're going to hold that perpendicular to the chest. We don't want to angle it in towards the heart at all. We want to go straight down, and we're going to bury that needle all the way down to the hub. Now we're going to wait for 5 seconds, and we're going to kind of listen for a rush of air. A lot of times you're not going to hear that rush of air because you're in a loud environment, especially if you're in a combat situation doing this, you're just not going to hear it. So you'll wait 5 seconds because right now this has a metal rigid catheter running down the plastic catheter, and that holds it open just in case the musculature were to constrict the plastic catheter. So it gives the lung time to inflate. Once you wait those 5 seconds, you're going to remove the needle, dispose of that in a safe manner, obviously, and then we're going to reassess our patient. So while you might not hear a rush of air, you're going to want to listen to lung sounds if you have time to do it, obviously if you're not in a combat situation. And you're basically going to look for the reversal of all the signs that caused you to do this in the first place. So increase in mental status, decrease in difficulty breathing, better lung sounds on both sides, increase of O2 saturations, and whatnot. Now, your second sites are found about the same way. What you can do for these is you can come down and you can actually palpate here. And I can say, all right, so I've got to the third rib. So I want that third intercostal space, so right underneath that third rib, and then you can kind of try to palpate over. It'll be easier on some people, harder on others, and come down to the mid-axillary line, and the insertion is essentially the same. You just hold perpendicular to your site and push all the way to the hub, wait 5 seconds, then remove the needle. And you're still listening for that whoosh of air coming out of it. So the insertion is essentially the same. And if you're one off, granted you have the leeway of third or fourth intercostal space, that